This presentation is an opportunity for us to discuss our commitment to research, not only locally here in New Jersey, but certainly across the United States and globally. And this could not be a more exciting time. And certainly it brings a lot of hope for our family members and certainly our persons living with Alzheimer's and all related dementia. So today's presentation will be talking about research. We'll be talking about the new advancements in Alzheimer's treatment. And then certainly we'll have opportunity for a conversation with community and address any questions that you have and provide more information as you see, helpful to better understand where we are and where we're going next in global research. Debbie, we look forward to this presentation. Thank you.
Well, thank you very much, and thank you for having us. And it is an exciting time in the world of Alzheimer's. They're really working on so many new medications and diagnostic procedures. I know I just went, and I think, Robin, you went to a different one on the research that's coming up for new things. And it was very exciting, like they're so close. And we know that this will happen. And Alzheimer's is a global movement. It's not just a United States problem, but it's all over the world, and everyone is working on finding new things. So without any more, we will continue. So what are we going to learn today? Well, we're going to be able to list the FDA, very important, approved treatments for Alzheimer's. And we are going to explain the impact of the brand new medication. Actually, I think yesterday was a year that it was announced. And we're going to explain the impact of that new medication, which we call Aduhelm. And it works on amyloid plaques in the brain. And it really has the potential benefits. And of course, it has some side effects, but it will certainly, there has been a lot of hope in that, as well as other medications. Now, we're going to explain the pathways to access treatment. You just can't get it because you want it. You have to meet certain criteria, and we will talk about that. And then, of course, finally, we're going to describe the resources that are available through the Alzheimer's Association. Now, did you know that there are more than 6 million Americans living with Alzheimer's? It's a lot of people. And for those 6 million or more people, there are over 11 million Americans that provide unpaid care for people with Alzheimer's or other dementias. So, this is why it is so important for research to look for ways to treat, to diagnose. It's because 6 million and, another 11 million caring for them. The new drug, which we'll talk about, did have an accelerated approval, and it was the first drug that has been provisionally approved since 2003. So let's take a look at the next slide. And we're going to look at this timeline. Now, way back in 1906, the first description of the disease was described. This was done by a man, Dr. Alois Alzheimer's. And he had, the initial patient, he had more after, that displayed all the symptoms that we know today are part of Alzheimer's, but nobody knew what it was. Their strange behaviors and, non-communication and everything we know associated with it. The only way back then to know what's wrong was after they died and do an autopsy. And that's when the autopsy of the brain saw these tangles and plaques that are so characteristic of Alzheimer's. So that was 1906. 1996, 90 years later, that was a big, long time, where the first medication was developed. And all of these medications I'm going to mention, they are for treating symptoms. They don't do anything about modifying the disease or slowing the disease or stopping the disease. They treat the symptoms. So 1996, Aricept, which we commonly know, donepezil, but we like Aricept. 4 years later, in 2000, Exelon was developed, also just to treat the symptoms. 2001, Razidine, right, another year later. Then we went 2 more years, Namenda. And then in 2014, which another 11 years, we made a combination drug, which we included memantine and donepezil, and we call it Namzaric, right? So you could see the timeline, occasionally, 2000, 2001, 2003, but there were long periods between the development. And again, they were really just to treat the symptoms. 7 years later, last June, we all remember it well. It was very exciting. We had the addition of Aduhelm 2021, and that was the first medication that would treat the biology of Alzheimer's. And that was very exciting to have that. No other medication could treat, the plaques and tangles that were part of it. So that's kind of why it was granted this, what we call accelerated approval. And we certainly will be talking more as we go on. Now, Alzheimer's is a very complex disease. And so research, is targeting a lot of the potential causes, including the two really, characteristics of the disease, the tau neurofibrillary tangles and the beta amyloid protein plaques. And these are very, very characteristic of Alzheimer's. And the tangles and the tau neurofibrillary tangles is a protein that keeps the cell healthy and allows for nutrients and other supplies to move through the cells. Sometimes the tau becomes twisted, and then we call it tangles. And they build up inside the cells of the brain. And so once that happens, what happens, they cut off the pathway for these proteins and ultimately causes cells to die. So, that's kind of what happens with Alzheimer's. Next. All right, targeting amyloid plaques. I like that we do everything in purple because that's our color. Researchers are studying beta amyloid plaques and amyloid plaques on Alzheimer's dementia. Beta amyloid is a protein, and it's naturally produced in the brain, but something abnormal, scientists think, happens with people with Alzheimer's. And when pieces of beta amyloid clump together, plaques are formed. And many researchers and scientists believe that these small clumps of beta amyloid is what contributes to cell death. And ultimately, when the brain cells are destroyed, and depending upon where it is, it impacts a person's ability to function. Now, in this slide, we're going to talk about that new medication, Aducanumab, how it's designed to work. Well, as I said before, this is the first treatment to address the underlying biology of Alzheimer's disease. But do remember, it is not a cure. It targets and reduces amyloid plaques in the brains of individuals living with Alzheimer's. And, remember what happens without this medication. Eventually, brain cells die. And so, by targeting the amyloid plaques to not build up as much as they did, hopefully will protect some of those cells. Now, treatment is not appropriate for people with both treatment may be appropriate for people who either have a mild cognitive impairment, MCI, that is due to Alzheimer's disease, or mild or early Alzheimer's dementia. So you can see it's early in the process. Also, treatment is appropriate when we can show evidence of a buildup of amyloid plaques in the brain. Okay. So let's talk about some of the benefits that may include. And one thing that may happen, a benefit, is reduction in cognitive decline, which has to do with memory and thinking, or a reduction in functional decline, like your activities of daily living and your, things that sustain your independence, which of course is very important, especially to people with dementia and Alzheimer's. So there really are just those two things that one of the things that make you eligible. And of course, remember, individual responses may vary, just like any medication. Not everybody has a same reaction. Now, let's talk about some of those side effects. The most common side effects were amyloid imaging abnormalities, and we abbreviate that ARIA, A-R-I-A. And we're going to talk in a minute about that. Another side effect, headache. And a third side effect, falling. And, headache, maybe we can manage. We don't want people to fall because then there could be other injuries. So let's go on. Okay. Let's talk about that ARIA, or those amyloid-related imaging abnormalities. ARIA is a common, but it's manageable. And it does not always cause symptoms, although it could be serious. It is typically a temporary swelling in areas of the brain that usually resolve over time. Some people may also have small spots of bleeding in or on the surface of treatment administered. How is the treatment administered? Well, number one, everyone needs to know it's by IV infusion, by the vein, of course, into the blood. It is done every 4 weeks. And in general, infusions can be done anywhere. There's an infusion therapy center, whether it be a freestanding center or part of a hospital. But, that is where it is given. So it's by IV and it's every 4 weeks done at an infusion center. Now, again, as I said, treatment may be appropriate for people with both mild cognitive impairment, which is abbreviated MCI, due to Alzheimer's or mild or early Alzheimer's dementia. So you have to have one proof of that. So how do we get that? Well, we can show evidence of a buildup of amyloid plaques in the brain by, number one, tests like cerebral spinal fluid analysis or amyloid PET imaging, which is part of a diagnostic process to determine eligibility. It's not approved for other types of dementia. So again, you have to have mild cognitive impairment due to this early Alzheimer's or mild Alzheimer's, depending upon what we call it. We have to show that there is an evidence of a buildup of plaques, and that can be done by your PET scans, or a newer way is through examining cerebral spinal fluid. And what they look for are little pieces of the plaque, because as it breaks off, some of it will go into the cerebral spinal fluid. Okay. Okay, how to access treatment. Yeah, how do we get treatment? You just can't walk in any place and say, this is what you want. You have to talk to your doctor. Now, if you start with your primary care physician, you can talk to them, but really what you need to have is a neurologist, because they are the ones that can recommend a person for this. Then you have to know and prove that you are eligible. And so we know we do that by the PET scans or examining the cerebral spinal fluid. But you need to have a specialist who then refers you to these tests to prove that you have Alzheimer's and you have the plaques. Next. What about if you don't have a diagnosis? Well, one of the things then you can learn about the 10 signs of Alzheimer's. And some of you may have been to a program where we have gone over what those 10 signs are. And they are things like memory loss that disrupts daily life, or you have challenges in planning and carrying out a problem. Maybe you can't complete what's really a very familiar task, like brushing your teeth. Or maybe you have confusion with time or place, or trouble understanding visual images and spatial relationships, which really has to do a lot with driving. And so you can see that problems with writing and speaking and misplacing things and kind of standing back from social engagements are part of those 10 signs of Alzheimer's disease. Well, if you think you have those signs, next thing to do is to visit your doctor. Then, when you go to your doctor, you want to share your concerns, get a diagnosis, and you more than likely will be referred to the appropriate specialist, which would be a neurologist. Okay, so coverage for the cost of treatment. I don't know what to say about this one. Medicare, has really not been not wanted to reimburse costs for this. And Alzheimer's, as well as other entities, have been working with CMS and other insurers to do what we can to get some coverage. And, the cost of it is expensive. And so, we are doing everything within our power. Right now, I think Medicare will only cover the treatments if you are already enrolled in a study. Next. Before I go to the association reviews, I just wanted to mention something that I know about MRI scans. And, we have to get an MRI scan before we start, and then the 7th and the 12th weeks of infusion. So you can see you're going to be having, a lot of expensive tests that need to happen. So our resources, and we have so many resources out there that I want you to be aware of. Now, 24/7 helpline, so important to have that number, and it's 1-800-272-3900. Right? Very important number to have everywhere. Have it in your phone. We have the magnets that people can put on their refrigerators. Write it everywhere. You can call this number 24/7. 3 o'clock in the morning, something is really bothering you. Pick up the phone and call this number. Someone will talk with you, will listen to you, find out, what it is that, you need that's bothering you. Do some research based on where your zip code is and come up with some choices for you. So never be afraid to call it. That's what they're there for. We have more than 200 languages and the TTD service as well. ALZ.org. If you don't like to call, you certainly can call this number. It will provide information and referrals. You can find free online education on the site. And there are, of course, other resources that we have, ALZ Connected and the Community Resource Finder. ALZ Connected is like a virtual whiteboard. You want to write a question, what did anyone do about, and whatever, and you'll get an answer back from somebody else in the community. And so finally, in the community, we have all kinds of educational programs like the one that you're doing. You have support groups. There are early stage programs, and a lot of it is as culturally and linguistically appropriate for all different people and languages. And we do have LGBTQ focused brochures. I do a lot of different support groups, and they're so important for people to be able to express their concerns, their fears, and most importantly, they find out they're not alone, that there's so many other people going through the same thing. Next. And our vision is a world without Alzheimer's and all other dementias.
Okay. And I'm the director of programs and services. I'm a research champion. So this is my favorite content to be able to present to all of you. And, as Debbie pointed out, our work is about our people and, of course, science. And just to put it more in perspective, the Alzheimer's Association is a worldwide organization. And every day we're dedicated to Alzheimer's care and support and research. And as we just reviewed, our mission is truly to lead the way to end Alzheimer's and all related dementia by fueling and accelerating global research, driving risk reduction, prevention, and early detection, and certainly in community, maximizing quality care and support. And as you see here, this is truly our logo. It's all about the people, it's all about the brain, and certainly all about the science. And so, in our time today, we're going to be talking about the landscape of Alzheimer's and dementia science, talking a little bit more about the importance of early detection and diagnosis, latest advances in clinical trials and therapies, and most importantly, especially in June with Brain Awareness Month, lifestyle interventions, and of course, how you can get involved. So, Debbie, I know that this is one of your favorite slides. Would you like to present it, please?
It is. Most people think that dementia and Alzheimer's is the same thing, but it is not. And if you take a look at the slide, you see an umbrella. This umbrella represents dementia, and we call it an umbrella term used to describe a whole range of symptoms associated with cognitive impairment, and it includes cognitive and behavioral and psychological symptoms. And it happens because of biological changes in the brain, and Alzheimer's is the most common one. And again, if you can see the slide, when we see different diseases underneath the umbrella, well, that's what they are, diseases. Alzheimer's represents 60 to 80% of all dementias, followed by vascular dementia and Lewy body dementia and frontotemporal and mixed dementia. So the important thing to remember is dementia is a symptom. All underneath that, including Alzheimer's, is a disease. And that is the difference between dementia and Alzheimer's.
Right. Debbie, do you want to talk a little bit about vascular dementia versus Lewy bodies?
Well, vascular dementia is very often associated with some type of heart attack, and why, a stroke rather, and why. Think about what happens with a stroke. There is a part of the heart and the blood flow that goes from the heart to the body, but specifically with a stroke, it goes to the brain. And there's, people think, oh, the whole brain had a stroke. No, the brain, one tiny little piece, think of the top of a pin. That's all it really, can affect in reality. Could be more, but it doesn't affect the whole brain. And so what happens with a stroke and is that the blood vessels and the brain, the things that have narrowed those vessels, things like fat and cholesterol and plaque and the things that we try so hard to control, is what caused the stroke and then can affect the brain, of course. And so if one of those little pieces with the stroke break off and they go to the brain, and then you have you could have dementia at some point, because it's going to make some of those cells die. And we know, of course, that that's what happens, and that's what causes a lot of changes in the brain and cognitive decline. I've seen people who have had a stroke who have difficulty in talking, which we know is a characteristic of dementia. They have trouble, with the words and getting them out, or trouble, moving, and many of them develop dementia as well. So, when I hear people say, oh, I have vascular dementia, my next question is, did you have a stroke? And the answer is mostly yes.
Right. And Lewy bodies is a different type of presentation where there may be hallucinations, behavioral types of modifications and changes. And frontotemporal lobar degeneration is usually affecting somebody a little bit younger. And please know that we have people in their 40s, 50s, and 60s presenting with memory loss, and it certainly could be much more progressive. So, looking at dementia as a syndrome is really important to understanding more about the work that we're doing. And Debbie, would you like to talk about 2022 facts and
Yes.
figures?
Yes, the facts and figures for 2022 came out in April. And, some of them are a little staggering. I mentioned before, more than 6 million people are currently living with Alzheimer's. And we know that the number is going to continue to go up, which is why this research is so important and so important all around the world. Um, One of the things that I like to talk about before we can all look at the other numbers, but more than 80% of Americans know little or are not familiar with mild cognitive impairment, which can be an early stage of Alzheimer's. A lot of people have never heard of what we abbreviate MCI. Um, the other fact that I have learned is most of your general and primary doctors don't really know what MCI is. And it's important, if you believe that something is truly going on, to seek more of a specialist. So that is a figure that always gets me, and it's why education is so important. People need to know and understand what MCI is. We can see with some of these other statistics in 2022, Alzheimer's and other dementias will cost the nation $321 billion, right? That's this year. By 2050, these costs could rise to nearly $1 trillion. That's staggering, isn't it?
It really
Um,
is. It's really something to pause on when you look at numbers that we can't even imagine, right?
I can't, yeah.
And the journey is a long journey. So we're always talking about care planning and early care planning. And certainly we could pick up that conversation as well. And as Debbie had also talked about, Alzheimer's disease is a continuum. So when we look at this particular graphic, we see that we start in that asymptomatic stage before we can even call it mild cognitive impairment due to Alzheimer's disease. And what's interesting here is that asymptomatic stage is when we don't even notice that there's any cognitive symptoms, but there are possible biological changes in the brain, as well as MCI, which is the earliest of stages that we just talked about. Nancy, do you have a question?
There was a question that came in through the chat. Can you hear me?
Yes.
Okay.
Yes, I can. Thank you.
Okay, so there's two questions. One is, once diagnosed with mild cognitive impairment, how long does it take to develop into a full-blown impairment?
I wish we knew the answer.
Yeah, it's so
I really
different in
do.
everybody.
It really is. And, we have that asymptomatic stage where we don't even notice symptomatology. And yet there are biological changes that could be taking place 20 years before symptoms even appear. So the mildest of symptoms where, things are happening, but we really just dismiss them is really, a stage that we have to pay more attention to because it is progressive, but it may take time to even move toward that mild, stage, dementia due to Alzheimer's disease. And we don't know. It could be someone in their 90s may be presenting and be completely healthy. And, they may just stay in that stage, or they may have other comorbid conditions like, we talked about diabetes, or we talk about heart disease. We truly don't know. So it's a very good question for further investigation. And I'm sure the Alzheimer's Association has, quite a bit of data that we'll be reporting out. Because when you look at the different stages, typically involves in that mild stage symptoms that are starting to really interfere with daily activities. And then moderate, more pronounced symptoms that truly do significantly interfere with daily activities, and severe stage. But it takes a long time. And the Alzheimer's, understanding of where we are in research and our movement has always looked at that mild, moderate, and severe stages. However, we got to move it further back. And that's what the Alzheimer's Association is trying to do, to make those research changes and advancements that are in that mild cognitive impairment stage, and even earlier when those biologic changes are starting to show on that amyloid PET scan that we were talking about before. Debbie, do you have any further comments about that?
No, that, pretty much is, what I would say. There's just no way of judging how quickly one goes through it. Some people say the moderate stage is the longest. Other people say the severe stage is the longest. And you know what? It really depends on the person. I've seen it all. And, everyone is different. You can't say, 92 days, we're going into the next stage. It doesn't work.
Very
like that.
different. That's exactly right. And so what may impact the risk of cognitive decline or a form of dementia? We like to talk about this. Debbie, do you want to talk a little bit about those non-modifiable risk factors like age and genetics?
Yeah. Well, our age is certainly the number one risk factor, I think. As we get older, people tend to be diagnosed more with dementia and Alzheimer's. And, can't say, we do have our early onset people who develop it before the age of 65, but more common it's as we get older. Now, genetics. Basically, there are two types of genes out there: risk genes and deterministic genes. If you have a big family history of Alzheimer's, your mother, your aunt, your father, or your grandfather, you have been able to trace down Alzheimer's through those different generations, you might want to take a look at your genes. Your risk genes say, yeah, you might get it. Doesn't say you will get it. You might get it. But your deterministic genes are like, yes, you will get Alzheimer's. So, that's something, that a person can choose to have. And truly, the earlier you find out, the better you can do planning. I know people say, I don't want to know any earlier than, I get it. But there's so much planning you want to do. Do it while you can do it, whether it be financial planning, health planning, what do you want? Let people know, again, while you can express it. So that is really one reason for knowing early. Race and ethnicity, and that certainly one's race has shown that they are more at risk than others. Sometimes it's because of where they live, lack of access to diagnosis and treatments. I know that we in Alzheimer's and Robin and I very specifically are working with a team that is trying to reach out to those who really traditionally haven't had the access. And, we've got all kinds of information that we're trying to impart about, what it is about, different languages. So, we are doing, what we can to reach out to others. Sex and gender, well, they say that women more often than not get it more than men. Um, I don't know. Maybe women live longer, and that's why. But you know, that's how I would answer that. Environmental, lifestyle factors. Certain things in the environment, how you live, what you eat, which we can certainly talk about more. Cognitive and social engagement. It is so important to be engaged with other people. Think what happened in the pandemic in the beginning. No one was seeing anybody, no one was going out. So you really didn't have any social activities. And it really did impact people, and especially those with dementia and Alzheimer's. Your diet, they say, eat a rainbow and, eat properly. You don't want to eat too much fried food and fats. So eat a rainbow. Get enough sleep. Really important that you get good sleep. You need sleep. When you sleep, there is like fluids that kind of wash your brain and try to get rid of some bad things, but you need that good, solid REM sleep to do that. Your heart, what they say, what's good for your heart is good for your brain, and that is true. The heart controls blood flow. If you don't get enough blood flowing to your brain, that creates problems. So what's good for the heart is definitely good for the brain. Engage in some type of physical activity, whether it be walks or some type of program. They have them now online, or go to your local community centers. And a couple of times a week, it's just so important. Try to avoid brain injury. Nowadays, kids wear their helmets and we wear seat belts. And I can certainly remember the time when we did not do either. And of course, education has shown to be a factor. The more education, and we've really, got our brain cells learning and moving and growing, it's really good. And avoid substance abuse, avoid smoking. These things are not good for you and your brain. I think I covered them all.
Yeah. So when we're looking at what's non modifiable, what we can't change versus what we can modify in risk factors, it's really important that we take a look at the areas that we are just talking about and the interrelatedness of risk factors. And I believe that next week we're going to be talking to community for more of a deeper discussion on healthy living for your brain and body. Especially June being Brain Health and Awareness Month. And as we go forward, when you take a look at overall risk, it really is a composite of non-modifiable and modifiable risk factors. And, we're going to be concentrating so much more on our research on social determinants of health that may impact some of these factors. And, we're just growing more, support and research allocations to our better understanding across all risk factors. And we're studying risk factors from all different angles. And that's really important because certainly, as you see on the slide, and as we talked about, Alzheimer's is unique to each individual person. So we cannot emphasize enough about this exciting time in research. The Alzheimer's Association is the largest nonprofit funder of research in the world. Currently, we have over $300 million currently active with over 920 projects in over 45 countries. And, on Capitol Hill, we continue to advocate for additional dementia research funding at the NIA and the NIH. And certainly when we talk about early detection and diagnosis, we're really concentrating our work on, understanding more about early diagnosis, especially in terms of the emotional benefit, the social benefit, as well as the medical and clinical benefits. To be able to help our families understand more about the symptoms that they may be experiencing, certainly exploring different options for treatment, not just pharmacotherapies, but different types of options like biomarkers. And certainly we're looking now at different types of testing, improving health outcomes, so important, different ways to prevent complications of Alzheimer's, the importance of legal and financial decision making. At the end of the month, we're going to be talking about managing money, a financial guide for caregivers, talking a little bit more about early care planning, how best to access care services, what options do we have in participating in clinical trials. And the Alzheimer's Association has a clinical trial matching service, a one of its kind, listing of all the clinical trials that are open and active in Alzheimer's and dementia research. And certainly we'll talk more about the importance of our work in modernizing this diagnosis, looking at different biomarkers and understanding more that 20 years or more before symptoms appear, the brain changes may begin. So we need to really look at certainly different options that are available. Lots of concentration, as we talked about, with risk reduction and more effective therapies. Debbie certainly reviewed where we were, where we are. And I think it's important to talk about for a moment, the fact that we're studying not just tau and not just amyloid plaque, but there are over 100 different unique therapies that are being tested today in clinical trials that target multifactorial aspects of Alzheimer's biology. So not just that amyloid beta and the tau protein, we're also looking at inflammation. That's such an important area, isn't it, Debbie? We study that with heart disease. Now we're studying neuroinflammation, right?
This is one of the things that when I went to my research update that really impressed me the most is all the different ways now that we are trying to learn about Alzheimer's and plaques and, exactly what's going on in all the different ways, not just one way anymore, but all the different ways and all that, therefore all the different studies. And I was pretty impressed with that part.
Right. So we'll learn more. And I just also want to mention that the Alzheimer's Association's International Conference is convening the end of July, the very beginning of August. There is a virtual option. So I'll certainly send to Nancy the link if you'd like to register. And also, we'll be talking about different ways to receive that information. But please know our next class will be talking more about risk reduction. We know, and this is a magnificent figure, up to 40% of dementia cases could be prevented or delayed by targeting modifiable risk factors. Isn't that interesting? 40% of dementia cases. And, we're looking at what we're going to be talking about next time. Physical activity, how important that is. Managing a healthy diet, right? Adapting healthier lifestyle behaviors and cognitive and social stimulation, an area to further explore, especially with the Ocean County Library branches. So many opportunities for cognitive engagement. So every study helps our scientists learn more. And certainly there's an urgent need for more inclusion. And as Debbie, had mentioned, Debbie and I are looking at different ways in which we can receive not only the information from, our colleagues at the Alzheimer's Association about clinical trials, but take this information and see if we could further expand knowledge and, certainly information and research opportunities with, all diverse populations so that we can have more opportunity to understand the therapies as it relates to all diverse populations. So certainly we could talk about that more. And just to mention, we have a number of different, just like we have the Alzheimer's Association family resources, we just want to emphasize a couple that are specific to research. One, of course, is our website. Research at the Alzheimer's Association, you see here, alz.org/research, as well as what I really enjoy every day is news. alz.org/science hub is our app. It's a free app that you can download in your either Google Play or in your Apple Store. And what it provides is the latest information on what's happening in the field and really interesting studies and tools. And, it's like you're reading a magazine. And, the AAIC, the report outs of peer review, presentations and journal articles and the news will be featured on that Science Hub app. So great opportunity if you're not able to attend virtually to just get the app and read what's going on. Certainly it helps with cognitive engagement. We talked about the importance of joining clinical trials at alz.org/trial match. And all of the clinical trials that are listed, they are listed after going through a review process, an IRB. So you know that those clinical trials are have been peer reviewed. Of course, we always talk about our helpline 24/7 to provide care and support. Debbie had mentioned the resources for support. Just another mention about our helpline, 800-272-3900. We have virtual programs that we present online, certainly in community with community partners like the Ocean County Library, but we have many different programs you can source online. And, benefits of a support group. And, I'm so pleased that the Ocean County Library is putting in place memory cafes for people that are living with earliest of stages of Alzheimer's disease and memory loss, or people that just want to learn more about how to engage, cognitively in everyday life. These benefits of a support group are so important, whether it be a memory cafe or a caregiver support group. We have our community resource finder, repository of all resources available in community. And so, in summary today, I hope that you understand how important research is to our work. It's an exciting time. We're discovering new tools for detection and diagnosis. And there's so much uniqueness to the therapies that we're looking at and investigating, and certainly new strategies to promote participation in the work that we do. So please know that we are hopeful in our research. And again, our vision is a world without Alzheimer's and all other dementia. And as you see, we have, certainly our helpline as well as our logo. All about the people, all about the science and the brain.
Support public libraries. Like, share, and subscribe for more great videos.